But I want to also direct you to our Facebook page because this is a meal that you want to see. Maybe it could inspire you as well. It's on our Facebook page. You can just go and then check it out. Here we go. It will be on your screen shortly. This is breakfast. I mean, we say times are hard, so when you have breakfast, it should be able to take you through lunch, and then you can have something light or later on in the evening. So this is our breakfast. And Samuel, Don, and Sue is asking, Mama V, where can I get this food to buy? Kwejo Opari Amwa thinks it's healthy, and I think it's healthy too. It's got some yam, it's got some pear, some plantain, ripe, unripe, some egg, greens, and I see some shrimps right there. This is the food to eat. But let's turn our attention to cholera. Also, we'll talk a bit about tuberculosis. My guest is Dr. Linda Van Otto, the Greater Accra Regional Health Director of the Ghana Health Service. And I want to say good morning to you.
Good morning.
So the rains have come, and we're afraid that because of the high figures we recorded in terms of cholera, we'll be getting there again. You are in charge of the Greater Accra region. How does the situation look like? I saw some figures yesterday. I didn't want to believe it.
Well, thank you very much, and good morning to all the listeners.
And our viewers.
And our viewers as well.
Yeah.
Well, last year, as you know, the Greater Accra region, unfortunately, recorded over 20,000 cases of cholera, with 121 deaths, unfortunately. It actually did not stop. It didn't come to zero as at the close of the year. And therefore, you realize that the region did not declare the cholera over. So as we entered the year 2015, we still had some cases carried over from 2014. And as we speak now, with the rains coming in, we are still recording cases of cholera. And even unfortunately, we have lost 3 already. So the cholera has not stopped. It is still with us, and we are still recording cases.
So which hospitals are recording the highest figures, and where did the deaths occur?
Just as we saw last year, it is still within the Accra Metro, the metropolis. You see, people can move anywhere for healthcare. So the fact that, let's say, Adabraka has recorded a case doesn't mean that that person is from that area. They move around, but the Accra Metro still has the highest number of cases recorded, both suspected and confirmed cases.
Okay. All right. Let me just also say that I sat down yesterday briefly with the acting medical director of the La Hospital, who also happens to be the municipal director of health services, the La Dade Kotopong municipality, Dr. Vera Opata. And I wanted to play this so that you can also hear some of the things that she talks about.
Right.
Do come with a lot of health challenges. We're here at the LAT General Hospital to talk to the acting medical director, Dr. Vera Opata, about cholera, because last year the hospital recorded a number of cases and even some deaths as well. So Dr. Vera Opata, thank you for your time.
Thank you for
How is the situation now as we speak?
The situation so far, I think it is okay. For now, we have not recorded any cases of cholera. However, we are keeping our eyes open. We are doing surveillance on cholera. We are also doing surveillance on the diarrhea cases, and every day and every week we chart the number of diarrhea cases that report in the municipality and then report to the facility, because those who are ill, by all means, they will report to the facility. Based on that one, we also screen the diarrhea cases, and those with signs and symptoms similar to cholera, we take the sample for confirmation for cholera. For now, we had one suspected cholera case. We have taken the sample, but it proved to be negative. It is, at first we used to send our samples to Kolebu for confirmation, but for now we have got some rapid diagnostic tests for cholera. So anybody who comes with signs and symptoms similar to cholera, then we suspected that it's cholera. We'll be doing the rapid diagnostic testing for cholera. So here on the spot, we will know if the client has cholera or not.
Is this something that people are generally doing in this community? Are they doing something right?
That we didn't report the cases. Well, it could be that last year we have had very intensive information campaign at the community level, at the household level. We also provided a lot of information at the various facilities to the population, to the clients that are reporting to the facility on signs and symptoms of cholera, or how to prevent themselves and their family from getting cholera. So it is possible that people are more educated, more enlightened. They have most probably also changed their behavior towards where they buy food, their personal hygiene, how they handle their personal hygiene. It is also possible that I don't think it's only possible. I believe, and I have seen it, that the municipal assembly have also done a lot concerning the provision of better sanitation within the municipality at the community level, and also improve the water supply to the community. So.
Okay, so that was a brief conversation I had, and I have to summarize some of the things that we talked about. The La General Hospital has not recorded any cholera incident cases yet, but one of the things that they are asking for, Dr. Linda Vanuatu, I'm sure that you can help. And I think the call was to NADMO to set up a tent. They want, like a cholera unit. So learning from the experience of last year, something they can do should they begin to record cases. So is that possible? Can they get it?
Well, not from my office directly, but I would facilitate that. What we actually need are places that we can keep them. If you go back to what happened last year, you realize that we had to turn our outpatients departments in many of our facilities into cholera reception areas. And that was not good enough. One, it stops us from using those places for the intended purpose. And that is that seeing people who have come to the hospital with other conditions and not cholera. It also stops the staff from doing work in that area. Because if the cholera cases have taken over the outpatients department, then those who are working there cannot do their work over there. So it limits the use of the space. Again, it also does not help with our infection prevention. Because if you are not careful, somebody who came without cholera and who was sitting around could get infection, and even the staff themselves or the visitors who come to the hospital to see their cases would also end up getting the infection. So we believe that we need to have places that are assigned specifically for them, and that is why they are asking for the tent. I would rather ask that if we had people, organizations that could help us to put up more permanent structures, that would be useful. Because the cholera cases occur during the rains, and you know how tents are. It is very easy for you to get the rains beating you whilst you are in a tent than if you were in an enclosed area. It will be good for the patients, it will be good for the service providers as well, if we had something that was more than a tent. But in the absence of it, and if we have a lot of cases occurring, then a tent would be okay for that time, but it should not be the permanent solution.
So what's the plan? Because we're still calling on people to come forward and help.
Yeah.
Exactly what kind of help do you need, and why can't you afford to help yourselves?
You know, cholera is not just help. Cholera is a multi-sectoral issue. It is developmental. And let me just remind all of us about what cholera is. Cholera is basically about someone drinking water or eating food or somehow getting feces that has the germ in it into his or her mouth. So it is not just health. We come in with the education for prevention, we come in with the treatment, and we come in with the restoration of health for those who have it and also for their relatives or the people that they live with or work with. So that is our side. Now, in terms of providing structures for the maintenance or for the management of all these things that we do. It is not our office that would put up the facility. We work with the district assemblies, with the regional coordinating council, with NADMO, NCCE, the Ghana Education Service, even the police, and all the other people whose work impinge on health. We work with all of them. So it is not just about us putting up the structures. That go beyond what we can do. So that is why we cannot put up the structures. And that is why we are calling on other people to support. Because this is really capital intensive. You know, taking care of the cholera patient, it's not just about the structure that the person will stay in, but we are talking about special beds that we need. The cholera stools have been described as rice water. So they come out without any effort. So we make holes in the bed that they lie on and put receptors or receptacles underneath the hole so that the person lying on it effortlessly will pass the stool. One, it is good for the person so that the person doesn't reinfect himself or herself, and also for the caregivers and even for the relatives who come. That's why we need that. And then we need infusions. One person who comes in very dehydrated means that the person has lost a lot of fluid. And if you imagine that one stool is received in a bucket, then you imagine how much water this person is losing from the body. So somebody can be given 10 bags, 12, depending on how severe the dehydration is. So that also costs money. And then the gloves that we use, several of them per one person. And then the giving sets, plaster, all these things cost money. So you find that health sector alone will not be able to do this, or even the assemblies alone will not be able to do this. Let me also add here that we have had support from UNICEF and from other partners, and that has gone very far. And again, when we find one case of cholera, we don't just treat that person. They go into the house or wherever he or she came from to identify who we call the contacts and give them medication to prevent them from getting the disease.
That is what the Greater Accra region is doing now?
Yes, it is part of management of cholera. Okay. So we do that. And that also costs money. The tablets that we give to the contacts and also the people that will have to go there to do that. And we keep surveillance on what is happening as well.
Okay, so with this issue about NHI service providers, you know, charging card holders, are we still going to see the treatments of cholera free?
Well, for us, we will treat them when they come. We will not ask them to pay, but someone has to pay for it. Because the infusions are not for free wherever we get them from. The giving sets are not for free. So I think that it is necessary to find a way of financing this, because as I said, the partners may bring money, but that will be for specific things like education, like going out to seek for the contracts, do outreach, do other things, and also ensure that people know what to do. But someone still has to pay for the infusions that the patients receive, the giving sets, the gloves, the bleach, all these things that we use.
So typically what will happen today should somebody with cholera walk into any hospital?
The person will be received, admitted, and given the necessary treatment. Because
free.
what we have done is that we have already purchased some infusions, though on credit. And we have given our staff the necessary refresher that they need. We are mounting surveillance on it. So if someone walks into the hospital today with cholera, and we have had cases, as I said, from January up till now, and they will be treated and will continue to treat them.
One of the issues with the La General Hospital was the fact that they had also, you know, bought some of these things on credits, and they have not paid. They're owing so much. And if they don't pay off, then it will be difficult for them to get more. What's the plan?
Yes, the plan is that we will still buy
on credits.
Yes, because otherwise the people will die. You know, we don't want anybody to die from cholera.
But your suppliers will not continue to supply you when you're not paying them. That is why
we'll continue talking. That someone somewhere, an organization somewhere, should support. You know, taking care of 20,000 cases of cholera, it's not easy. If you imagine the amount of time needed for one person. The infusion is running, you have to make sure that it is, and you have about 50 people coming at the same time. So if people appreciate the magnitude of this and appreciate the amount of money that goes into it, I'm sure that there are some companies somewhere, some individuals somewhere who can do this. They can decide that, look, how much infusions have you bought? Maybe 300,000 Ghana cedis. I will pay for it. Or how many beds do we need? I can make just one bed for you. That will be fine. If we have 100 people, each one of them making one bed for a cholera patient, that takes care of 100 people. And that will be good. Instead of us nursing them on benches or even letting them sit. Can you imagine sitting and passing stools like this? But even if they are ill, they still have their dignity. And that is what we should look at. That's why for us, we'll continue to treat them. We'll continue, but we'll also continue to educate the general public that this is a preventable disease.
Okay.
Yes.
But is this our last resort? Is this our only option? Make appeals and get people to help us pay off the debts?
Well, the ministry also pays some. But you know, we don't know how many cases we'll have this year. Last year, we did not envisage that we'll have 20,000 cases, although we knew that we would have cases. And this is the worst in many years. We keep track. From 1999 till we know how many cases we have been recording in a year. The highest had been about 9,000 over the past many years. So the 20,000 plus for Greater Accra alone was huge. And that is why this year we are not leaving anything. And we are going all out. And that is why we believe that people should support. Because the ministry can support, the partners can support, the assemblies can support. They have done well. Rubbish heaps have been removed from some places. They are looking at the final disposal sites. People have been put before the courts so that they do the right things. Education is going on. We have the WASH program also ongoing. But the funding is also necessary for us to be able to pay for these infusions and also to pay for other things, including even bleach. You can even decide to donate bleach to whichever facility you want to. And then also our reception areas. Yes.
Okay. Let's quickly touch on tuberculosis, because today, 24th March, is World Tuberculosis Day. The day is marked every year, highlighting one of the world's top health challenges. With 9 million new cases and 1.5 million deaths each year, tuberculosis is an ongoing epidemic. So quickly, I just want you to tell us a little about tuberculosis. How do we detect it, and can it be cured? You know, things
Yes.
like that.
I'm happy we are talking about tuberculosis because it's a disease that can affect anybody. But it is also treatable. We can treat it. And the treatment, again, you don't pay for it.
Oh, that's also free?
Yes. What you do is that if you are at home, wherever, you have a cough that does not go away a week or so, you go to the nearest facility. What we do is that we get your sputum. You cough, you bring out a sputum. It is tested. If we find the organism in it, depending on what it is, we put you on treatment. And we have treatment centers around. We have places that they can also do the diagnosis. So we do that, you are put on treatment, and if you follow the treatment, we also test you 2 months after, 5 months after treatment, and see how you are doing. If we need to continue with the same treatment, it is done. If they need to do any changes, that is also done. And then at the end of the treatment, they test you to see whether now you are negative. If we do not know that you have TB and you are around and coughing, you spread it to other people. And also for people who has reduced immunity or who have diseases that are chronic and prolonged, we can have TB in them. So for example, somebody can have diabetes. And when you go to the hospital, we also screen them. And once we find that you have TB, we treat you, in addition to the diabetes or the hypertension or whatever disease that you have. So we treat you. TB can also affect children. But the children may not show the classical signs of coughing and all that. But we in the health sector know how to identify it. It may be that the child is not even gaining weight, or the child to you doesn't look so well. You know, mothers can tell, or fathers can even tell. You take your child to the hospital, we screen them. TB can also affect not just the lung. What we are talking about now is the lungs, what helps us to breathe in and out. So you realize that if the lung is affected, your breathing will be affected as well. But it can affect other parts of the body.
Okay.
And when you go to the hospital, we test you. We can also diagnose those that are outside the lungs and treat you as well. So TB is treatable.
Okay. But is it a threat in the Greater Accra region?
We have cases, yes, we have. And, you know, because it is preventable, because it is treatable, and because it can be spread from one person to the other, we will say that it is a threat for health. Because we shouldn't let it just be like that. And that is why we tax our facilities. Every population that we have, we need to be looking for the cases of TB so that we can treat them. And for us, in some of our facilities, the detection is quite low. And we encourage them to do more to identify more cases.
So you are assuring us that irrespective of the fact that some health providers, because they are not getting their monies being paid to them by the NHIS or the NHIA, TB, cholera, these cases would still be treated free of charge in any of the facilities?
Yes.
Okay. All right. I want to say thank you for your time, really, as we observe this day. I really appreciate your presence here. Dr. Linda Vanutu, the Greater Accra Regional Health Director, the Ghana Health Service, talking about cholera and tuberculosis.
3, 2, 1.
Hi.
Good morning.